Good morning, staff of Neonatal Care Unit. For those who don't know, I'm Margie Stanley, a new graduate registered nurse. I've conducted this in-service to address design of neonatal units and how our current layout as an open bay ward affects both patient safety and a healthy workplace. I've been asked to present this in-service as a newly graduated nurse with a fresh perspective. With the hospital planning and upgrade, I think it is vital for nurses to take leadership in implementing evidence-based designs for unit layout, especially within neonatal care, as inadequate design can affect neuroprotective care and have long-term detrimental effects on our patient outcomes as well as our own job satisfaction as healthcare providers. Through this presentation, I will address why neonatal care unit layout is important, examining the background of NICU layouts and how they have changed over the years. I'll outline how an improved design can significantly improve patient safety and make patient, staff and family environments healthier. Finally, I'll demonstrate the current research and what we can do to improve our ward environment. It is important to outline some of the recent facts from Australian Institute of Health and Welfare to understand why our work matters and why we really need to be providing the highest quality evidence-based care. Over the last decade, there has been a steady increase in percentage of admissions to neonatal care. Risk factors for requiring neonatal care include multiple births, babies born to Indigenous mothers, and premature births. Almost 9% of all babies born were premature, and 74% of preterm babies were admitted to either special care nursery or neonatal intensive care units. While the number of births annually increases and percent of those requiring hospital care is also on the rise, as demonstrated, we need to ensure we are providing the highest quality evidence-based care to our vulnerable patients, their families, and to ourselves. So why does the design of the ward matter? Contemporary research has shown that the design of neonatal care units has implications on the babies, their families, and staff. The infants we care for are often some of the most vulnerable patients in the hospital, and therefore the design of our ward needs to allow them to conserve their energy through neuroprotective care and make it as easy as possible for caregivers and healthcare professionals to help the infant in whatever way is needed. The layout of a newborn care unit has a significant role in patient safety and clinical outcomes. All people involved in neonatal care, including newborns, caregivers, family, friends, healthcare providers and other hospital workers, are affected by the design of the unit. For newborns, the transfer from the mother's womb to the intensity of neonatal care unit can be overwhelming, especially for the underdeveloped premature infants. The neonatal care unit should be designed to promote the health of neonates above all else. The lighting and acoustic levels should be controlled to minimise environmental stress to infants, encouraging neuroprotective care and allow sufficient neurological development. Increased environmental stress can be potentially detrimental to neonates who lack mature organ systems and the ability to adapt to abrupt changes. Family and visitor comfort are additionally affected by the basic design and location. Privacy for breastfeeding mothers and for skin-to-skin care, along with comfortable seating and bedding options, have been outlined as a priority for caregivers. Healthcare providers and hospital workers require layouts that promote team collaboration and communication, encourage hand hygiene, and allow continued learning. Furthermore, studies have demonstrated that poor climate and environmental design of the wards contribute to medical error. Generally, the design of the newborn care unit should address the emotional, physical, developmental, medical, and social needs for all involved. Optimising the provision of healthcare to infants requiring neonatal care without compromising individual patient development has long been a goal of NICU healthcare providers, but has changed remarkably. The first premature unit was opened by Dr. Julius Hess at Sarah Morris Hospital in Chicago in 1914, which utilised his own developed incubator. The care of premature infants was then exhibited to the public at the 1939 New York World's Fair, where visitors could purchase tickets and witness the tiny humans and those who care for them. In 1960, the first modern neonatal intensive care unit was established by Dr. Louis Gluck, where an open room is filled with newborns in the incubator. This design has been the foundational layout for many years. However, during the 1990s, the concept of single-family room layouts of neonatal units was proposed and has been a growing trend as more research supports the benefits to the patients, families, and hospital workers. NICUs are actually among the last of healthcare specialties to update from open multi-patient wards to private rooms. The open bay environment allows team communication and collaboration between nurses, allied health and medical staff, with the additional ability to monitor multiple patients simultaneously. However, several studies have concluded that key factors associated with improved neonatal outcomes are not included with this design. Open bay wards lack privacy, impede parental involvement in care, and lack highest quality infection control principles. The loud, bright, and uncontrolled temperature of the environment is physiologically stressful and certainly not optimal for premature infants with immature organ systems requiring neuroprotective care. Continual invasive cares adds to the physiological stress, interrupting sleep for the patients, which is associated with both longer hospital admissions and detrimental long-term effects. Positive design features need to be considered and understood by healthcare providers, managers and planners for the proposed updated neonatal care unit. Conscientious healthcare service planners and architects are becoming increasingly aware and over the past 2 decades have initiated evidence-based design into the layout decisions of the NICU. Evidence-based design analyses the best available research to design patient rooms to ensure safe and comfortable environment for patients and their families, along with optimal working conditions for staff members. Factors considered in the design process include improved lighting and air quality, reduced noise, walking distance and directions, promotion of hand hygiene, and accommodation of family needs. Evidence has shown that hospital design can significantly improve patient safety and make staff and family environments healthier. Although research is ongoing, studies have deemed single-family rooms superior for patient care, parent satisfaction, and workplace health. Improved medical outcomes and health benefits noted from infants in single-family room units compared to those in open bay wards include fewer apneic events, reduced nosocomial sepsis and mortality, increased weight at discharge, and earlier transition to enteral nutrition. More mothers reported sufficient lactation and more infants were discharged with breastfeeding in the single-family rooms. Parental and family satisfaction was reportedly higher when private rooms were provided. In regards to staff, initial challenges were experienced for teamwork and communication in some studies. However, perceptions of decrease in teamwork were no longer statistically significant after 8 months post-transition. Furthermore, other studies have reported an improvement in collaboration among staff members when updating from an open bay ward to single-family rooms. It is possible that innovative communication venues allowed improved perception of teamwork along with high-quality staff areas. Initial concerns are raised for the cost of private room design. However, many studies have supported this to be the most cost-effective layout. Reduced length of stay, reduced readmissions, fewer infections, and improved weight gain counter the increased developmental costs. Additionally, earlier discharge allows a higher turnover of patient, increasing our availability to assist the next critically unwell baby. Overall, the single-family room layout is optimal for the patient, their families, staff, the hospital, and newborn care in the wider health district. So, what can I do about it? Well, as a new graduate registered nurse, I have approached neonatal nursing with an open mind, been observant and interested in best practice. I'm committed to being a change agent, advocating for evidence-based care to our patients and their families, and remaining current with research. As a team, I want us to be the leaders in neonatal care and approach management with innovative ideas for the development of our updated ward. Higher management will be involved in the process, along with the legal and ethical committees to ensure an optimal design of the neonatal care unit. With this knowledge and looking to the future, what can you do about it? You can be an advocate for evidence-based design for the development of the updated ward. You can remain up to date and well informed in current research regarding neonatal care and evidence-based design. There are many studies currently investigating the benefit of single-family room and how to optimise the care to the neonates. For example, a study in the US is being completed at a health centre in Halifax, whilst their neonatal care unit undergoes redevelopment to single-family rooms, and they'll have the unique opportunity to care for the patients in either setting. Random allocation to open bay ward and single-family room design will be assigned to participants to evaluate both short-term and long-term effects on the patients and family. You can also openly discuss and seek feedback from other staff members, family and visitors. Find out what we do well and what requires improvement. And through these open discussions, inform others of research in regards to evidence-based design. Before we can obtain the benefits of single-family room design, we need to ensure our open bay ward is able to support neuroprotective care. We can accomplish this through strict adherence to quiet time in the ward, where lights will be dimmed, visitors minimised, and only essential care is provided. Additionally, we will be encouraging family comfort in the ward through the provision of privacy screens when appropriate, and encourage caregivers to be significantly involved in patient cares. Through this, family will be feeling welcomed in the ward, and we should encourage them to spend extended time with the patients. When family are not available and we are to provide cares, we should be providing them in cluster cares to ensure minimal disturbance to the newborn, allowing them to rest and develop their immature organ systems. Hopefully through this education, you can understand the importance of evidence-based design of the neonatal unit. Thank you for listening, and thank you for all that you do.